Hello everyone, this is Dr. Shawn Pourgol. I'm a manual osteopath, and today I want to speak with you about how international medical graduates such as physiotherapists and doctors and nurses can work in Canada. Foreign trained, foreign graduated medical graduates. There is a way for them to work in Canada, find employment, or open their own clinic. First of all, I want to give thanks to God for being able to be in Canada one more time to see the snow. I thought I never get to see snow anymore. I live in Panama now. I just came back from Naples, Florida. I went there to do some work for university, the National University of Medical Sciences, the first and only school of manual osteopathy in the United States. And I came here. I had to go under quarantine for 2 weeks, and this is the first week after quarantine I was able to come out and enjoy the snow. So I'm very happy that I see the snow one more time. I even get to touch it. So how you can, as a foreign graduated health professional, can come and work in Canada? First of all, it's very hard for you to practice in your own profession in Canada. The authorities in Canada, the health authorities such as College of Physicians and Surgeons and College of Physiotherapists and so on, they have a lot of power, and they made it very hard for foreign trained health professionals to come and work in Canada. On average, for example, most physiotherapists fail, and the ones who pass, it takes them 5 to 10 years of writing exams, spending thousands of dollars for exam fees before they can get the license to practice in Canada as a physiotherapist. For medical doctors, it is almost impossible. It's very rare for a medical doctor to get license to practice in Canada. It takes many years. It is almost impossible. But there is a way for you to immediately get into workforce, start making good money, and have a financially and emotionally rewarding career. And that is by becoming a manual osteopath. We have a lot of physiotherapists, a lot of doctors, nurses from other countries who have joined us in one of our 3 schools. We have 3 schools: National Academy of Osteopathy Canada since June 2010 in Toronto, Canada. Then the National University of Medical Sciences Spain since 2012 in Spain, and then in 2016 NUMS USA in Naples, Florida. The good thing about our program is that for National Academy of Osteopathy in Toronto, it is over 2,000 hours, 2,200, accepted by many of the osteopathic association in Canada, such as College of Registered Manual Osteopaths. It's a national non-profit organization, indigenous peoples owned, operated, and they are accepted by many insurers in Canada. College of Osteopathic Manual Practitioners of Ontario, the same accepts our alumni. ACMA in Quebec, a national association, and many other associations. Over half of the manual osteopaths in Canada are our graduates. As such, most of the osteopathic associations in Canada are funded by our alumni, and they accept our graduates. So if you plan to study osteopathy, make sure you study in a program that is at least 2,000 hours or more in length, because otherwise the association will not accept you in Canada, and then you cannot do insurance billings. So to do insurance billing in Canada, you have to graduate from an accredited school, and National Academy of Osteopathy in Toronto that offers a DOMP, Diploma in Osteopathic Manual Practice, is one of the accredited schools in Canada. The DOMP program of NAO is 1 year full-time for high school graduates, but for you as a health professional, you get a lot of exemption for many of the courses such as anatomy and physiology, and you can complete the program in 6 months. Additionally, we offer it also online. Therefore, it means before you even move to Canada, you can complete the program, and when you come to Canada, you can easily open your clinic in all Canadian provinces and start working as a manual osteopath in Canada. We are the one who introduced osteopathy, manual osteopathy, to many of the Canadian provinces. For example, Yukon, Northwest Territory, Prince Edward Island, Newfoundland, and Labrador. These provinces, they did not have manual osteopathy before our school in NAU Canada came along, and after that, now all the manual osteopaths working there are our graduates. There is also a way for you to find employment in Canada as a manual osteopath, and that is by contacting rehab clinics, physiotherapy clinics, chiropractic clinics, massage therapy clinics, medical offices, and offer them to work to give you a job as a manual osteopath. I made another video, that it shows you how to do so, so you can check that out, exactly how to go about doing so. That's another way, but most manual osteopaths, they don't like to work for others, and most of them, they open their own clinics quickly. Financially, it's a rewarding profession for even more than many other health professions. For example, physiotherapists in Canada on average make $76,000 per year in gross income, while manual osteopaths of other schools, they make over about $90,000 per year in gross income, while our students in Canada make about $150,000 per year in gross income. And another benefit of becoming a manual osteopath is that our net income is very high, while other professions spend up to 50% of their income for gross income for clinic expenses. Manual osteopaths typically spend only 10 to 20% of their income as clinic expenses. One more benefit is that manual osteopaths usually are fully booked because of their ability in treating chronic pain. While most other health professions can treat acute pain very well, not so many can be very successful in treating chronic pain, but manual osteopaths are experts in treating chronic pain. I opened a clinic in September 2017 in Toronto, Osteopathic Chronic Pain Clinics of Canada. From one clinic, now we have 333 clinics in 30 countries such as India, Pakistan, US, Spain, Malaysia, Singapore, Iran, and so many other countries. We only hire our own students for these clinics. Nobody else can join it, and many of the manual osteopaths working in these clinics are internationally graduated, international medical graduates such as physiotherapists, chiropractors, and medical doctors and nurses, and so on, occupational therapists, and so on. Osteopathy gives you an option to get into the workforce in Canada quickly. Also, if you are outside Canada, it can give you an option to get job offer from Canada. But when you are trying to get a job offer, please do not approach the big city clinics, because they usually have enough like osteopaths in the city, manual osteopaths, to get those jobs, while small towns in Canada, they rarely can find manual osteopaths, because most manual osteopaths are concentrated in big cities. So try to choose a province with not so many manual osteopaths in them, that gives you a better chance. There are also other professions you can consider. Chiropractic, for example, is another option. They have a 4-year program, and as a international medical graduate, you can get some exemption from some courses, but I don't recommend you become a chiropractor. They don't have so many patients these days, because most of their income, up to 50%, was coming from custom-made foot orthotics, which 3 years ago insurance companies delisted them from, and they don't cover them when they prescribe and dispense custom-made foot orthotics. So they're struggling. They have to bring a lot of patients in, 30 to 40 patients a day to have a lucrative income, while manual osteopaths needs about 8 patients a day to have a fully booked practices. Naturopathy is another profession you can enter. They give you, I think, up to, if you're a doctor, they give you 2 years off of the 4-year program. You can graduate in 2 years as a naturopath, but again, I don't recommend you to do so because naturopathy, while it's an amazing profession, it focuses a lot on herbal medications, which other herbalists and others can also do. So they have a lot of competition. Also these days, a lot of client patients, they self-medicate. They research themselves and they order the herbal products, supplements themselves. They don't feel the need to go and use a naturopath services. Additionally, not so many insurance companies cover naturopathy, and patients generally don't want to pay for services of a naturopath. While for manual osteopaths are similar to dentists. When patients have chronic pain for 10, 15, 20 years, they pay any money they can to get relief, because they can rely on medications. How long you can take Advil and Tylenol and naproxen and other anti-inflammatory and pain medications. You cannot take them for 5, 10 years, 20 years. It damages your liver. So patients have no choice but to see a manual osteopath, and that is why they're so busy. Also, there are not so many of them in the whole Canada. In whole Canada, there are between 2,000 to 3,000 manual osteopaths, and there is no competition for them. While in Ontario, the province of Ontario, for example, there are 11,000 physiotherapists, 11,000 massage therapists, 5,000 chiropractors, 7,000 acupuncturists. So there are a lot of competition for them. For manual osteopathy, I don't see it in our lifetime ever become saturated. Maybe in 50 to 100 years from now, it can become saturated, but not anytime soon. I feel personally manual osteopathy is a great profession for you. It's something that offers you a great benefit. Out of the 20, research showed out of the 25 health professions in Canada that they did research, manual osteopaths have the highest job satisfaction rate at 98%. Means they are happier with their work than any other health profession. And well, sorry, the wind almost dropped my camera. I had to bring the camera low to be more stabilized. I apologize. Usually I keep it higher, but the wind was so much, and now almost was dropping it. I apologize for that, but I'm ready to grab and jump and grab it. Yes, and I was saying that also the research showed manual osteopaths have 97 patient loyalty rate. That is amazing. That means more than any other health profession in Canada. Family physicians have 75% job satisfaction, patient loyalty rate. Chiropractors, physiotherapists, massage therapists have about 60%. It means once a patient sees a manual osteopath, Out of 100 of them, 97 of them remain with that manual osteopath for life. That is the beauty of it, and it's all because of the ability of manual osteopaths in treating chronic pain. That is huge. Not so many people can treat chronic pain, but we do, and that is why we get fully booked practices. Additionally, we in our 3 schools, I teach my students over 200 business lectures with a lot of other lectures about improving the brain, how to increase their income, asset protection, tax planning, marketing, and so on. That is why our alumni make on average $60,000 more than other manual osteopaths in Canada. I can speak to you for hours about how beautiful this profession is, how miraculous it is. It is miracle on a day-to-day basis. But now it is very cold. It's freezing here. My nose is cold. The wind is almost blowing away my camera. My hands even with gloves are freezing. I have to finish it, but I'm still grateful to God. Thank you, God, for giving me all this beauty. This snow has beauty in itself. It cleans the air. It's just beautiful, lovely. I love it. I'm happy that I'm back in Canada. Please stay safe. Oh wow! This time the wind almost blew it. Wow! I have to hold it. Wow. Okay. Please stay safe. And oh, my nose is so cold. Sorry. Please stay safe. I pray for you wherever you are to have a happy, healthy, wealthy day. Do not let the coronavirus to get you down. Be positive. Have fun indoor. Get some sunshine in your backyard, in your neighborhood, and please stay safe. Follow whatever the government tells you. Wash your hands. Don't touch your face. When you buy groceries, make sure you wash them with soap and water. Disinfect everything. And this will pass too. Science will overcome this. Humanity will overcome this. That's what we do. We are fighters. We get up on our feet. We will survive. God bless. Have a wonderful day. Thank you for watching this video. I love you all, and my love is with you. Namaste.